Hi, my name is Adele, and I'm going to be going over the career topic of a physician assistant. So the main role of a physician assistant is to provide diagnostic and therapeutic patient care in virtually all medical specialties and settings. They can take patient histories, perform physical examinations, order laboratory and diagnostic studies. They are able to prescribe medicine and develop patient treatment plans. For a PA, they do need to practice medicine under the direction and supervision of a licensed physician, and their work helps to extend the reach of healthcare services and contributes significantly to patient well-being. They can specialize in certain fields and specialties, such as primary care, surgery, emergency medicine, pediatrics, dermatology, and other specialties. So since they are allowed to prescribe medications, they can perform medical procedures such as casting, suturing wounds, and fractures. They work closely with physicians and other healthcare professionals to provide care to patients. They collaborate on patient care plans, discuss diagnoses and treatments, and contribute to decision-making regarding patient management. And I just included this picture of a day in the life of a physician assistant. So it shows that they just stitch wounds, they set bones, and they do need to pass an exam, which I will get into later. And they are allowed to prescribe medications. So there can be different work settings that they do work in. It depends more on which they would pick and which specialty they would have. So they can work in hospitals, clinics for doctors, community health centers, retirement communities, retail clinics, schools, workplace clinics, and prisons. So specialization involves additional training and certification in a particular area of medicine, such as cardiology, emergency medicine, radiology, pediatrics, obstetrics, gynecology, and anesthesia. They also can work for other federal government departments, including the Department of Veterans Affairs, and are members of the country's uniformed services. So getting back into the education requirements for becoming a PA. So the medical education is intense, and their requirements are pretty particular for going into a PA program, and it's based off both didactic and clinical educations. Students study medical sciences, behavioral science, and behavioral ethics during the didactic period. You do need over 2,000 hours of clinical rotations in various medical surgical specialties such as family medicine, internal medicine, gynecology, pediatrics, general surgery, emergency medicine. And these are all completed during the clinical phase. If you know that you're interested in a career in medicine early in your educational journey, you should most likely consider going into a major such as biology, chemistry, or anything in the STEM field, but you can go in such as liberal arts or other majors. But if you do plan to go into a PA program, then you should pick a requirement such as those majors, just because of the science courses you would have to take, such as anatomy and physiology, biology, chemistry. And you do gain experience with hands-on clinical experience, since most PA programs do require a certain amount of hours or patient experience. And once you do enter and graduate into the program, you will need to pass the Physician Assistant National Certifying Examination, also known as PANCE. It is a 5-hour exam involving 300 multiple choice questions designed to test that you have the medical knowledge you need to begin your career practicing PA. You can apply to take the exam 180 days before your completion of PA school, so you can plan it ahead. And after you do pass the exam, your final step is to gain a license in the state where you would like to practice. Every state has its own regulations and procedures for when it's licensing process. So once you've decided where you want to practice, you need to apply to the licensing board of that state and follow the instructions for obtaining your license. There is a lot of preparation in the undergraduate program that you would have to do, such as taking the science courses, which would be medical terminology, genetics, chemistry, anatomy, physiology, and you should have an experience with PCE and HCE. And some examples of that I included in my next slide would be things such as a dietitian, a phlebotomist, medical technician, physical therapy aide, military medic or corpse person, EMT, a paramedic, dental hygienist, hospice worker, international healthcare-based mission trips. These are all just some examples of ways to get PCE and HCE that you would need for applying to PA programs, and are a great way for you to get hands-on experience with patients. And there are many benefits to becoming a PA and the career overall itself. It does have excellent job security, and the job market for a PA is expected to grow very rapidly, according to the labor statistics. And as you can see, the 90th percentile make $124,770. There will be nearly 40,000 more jobs for PAs in the next decade. And as well as competitive salaries. Since they do make good money, it is pretty competitive. A job as a physician assistant can pay well. The annual salary for PAs in 2022 was between $105,000 and $126,000, with a median salary of $114,000. Another main benefit of becoming a PA would be to focus on patient care. If you love working with people and you're interested in building relationships with your patients, a PA would be a great choice. And you're directly responsible for your patient care, so you would likely be performing hands-on medical procedures. So you'd be working one-on-one with patients, so it's a good way to do that. Career flexibility. As a PA, you can pivot between specialties in your career. And you may begin internal medicine and shift to dermatology or orthopedics, your education and training for a dynamic career pathway. And as well as that, with the career flexibility, it also does offer schedule flexibility. Most careers in the medical field do require long hours and on-call responsibilities, but they do have the option to work in different types of clinical settings, so you will have the option to find a schedule that works best for you. And you may choose a shift work that works with the flexibility depending on your specific workplace, and to choose how much and what days you work and when you would like to work. And the outlook for the physician assistant career in 2022 and 2023 is 27%, which is much faster than average. Over a 10-year period, 12,200 physician assistant positions are expected to become available annually on average. It is anticipated that a large number of those positions will arise from the need to replace employees who change careers or leave the workforce for other reasons, such as retirement. A reason that I love this career is the flexibility of the profession in general is what drew my attention and made it so intriguing to me. The healthcare industry is a fantastic occupation that offers lots of opportunities for advancement and personal improvement. Things in this line of work are always changing, which allows for career advancement. This career can lead to a wide range of changes and paths. You can pursue additional education, training, and specialization in other areas of interest with this degree. There is a history that came with the career of a PA. So it was first introduced in 1967 at Duke University. It was used first to assist Vietnam veterans who had served as medics. Initial membership was made up of first students and graduates of Duke University PA program, among which were former military corpsmen. And these three were physician assistants in the class of 1967 that I included in the history, and you can find more information on the career of a PA